Bacterial conjunctivitis or pink eye. It is time when cases of pink eye start spreading everywhere. Therefore, diagnosis, treatments, and preventions are made simple in this video. Pink eye is a common term used for conjunctivitis, whether bacterial, viral, or allergic, due to the pinkish appearance of the eye of the affected individual. But bacterial, viral, and allergic conjunctivitis do have different manifestations, which is also made clear and simple in the next video. Bacterial conjunctivitis is an inflammatory disease of conjunctiva, and it is one of the most commonly encountered eye diseases in clinical practice. These are the four major signs usually seen in patients with bacterial conjunctivitis, which are easily identifiable as you can see. We have lid edema, which means swelling of the lid, mucopurulent discharge, which is described as thick creamy discharge, which causes the eyelashes to stick together. And we have matted cilia, meaning the eyelashes stick together, and flecks, which are seen in advanced cases, where a thin piece of lid skin extends downward. And among all these signs, the main sign identifying bacterial conjunctivitis is this mucopurulent discharge. Now the major symptoms. Major symptoms the patients experience are pain and redness. As we know, there is difference between symptoms and signs. So the symptoms are what the patient feels that the examiner cannot identify directly. The symptoms is always recorded from the patient's own account. The redness is described as sandy sensation that the patient feels as if a sand grain is in his eye, which is actually not, but due to the inflammation of the conjunctival feathers. Treatments. An acronym for the treatment is SAT, which you can easily remember as past tense of sit. So SAT, S-A-T. The S stands for steroids, A stands for analgesics, and T stands for topical antibiotics. Why steroid is used in the treatment? An anti-inflammatory drug like steroids are prescribed to treat pink eye since it is an inflammatory disease. Example of the most commonly used steroid is dexamethasone. So analgesics as well are prescribed to relieve the pain. That's the main reason, primarily to relieve the pain. And then topical antibiotics are also prescribed as bacterial conjunctivitis is caused by bacteria. So topical antibiotics are applied to kill the bacteria and prevent secondary infection. Prevention is by personal hygiene, which include the following steps that a person should follow to prevent himself from bacterial conjunctivitis. The first step is wash your hands often with soap and water, and avoid sharing personal items like your glasses, handkerchiefs, or towels, etc. And do not use the same eye products for your infected and non-infected eye, as you can separate the infection from infected to the non-infected eye while using the same eye products. So you see how easily you can diagnose, treat, and prevent bacterial conjunctivitis in an easy way. So follow us in our next video for better understanding of the main difference between bacterial, viral, and allergic conjunctivitis. If you're finding it difficult to differentiate their manifestation, that is also made simple in the next video. See you next.